Baldness is a very common problem for both males and females. In males, this is male pattern baldness ranging from type 1 to type 7 depending upon the severity of hair fall. There are certain factors. In males it can be genetic, hereditary, stress, smoking, and some drugs are there, so which cause hair loss. And in females this can be stress, smoking, and also some hormonal changes. So for baldness the treatment is hair transplant. There are other non-surgical treatment also. Drugs are there, some like minoxidil, then finasteride is given, and omega-3, omega-6 fatty acids and multivitamins. These are prescribed as certain, whenever the patient comes, there is certain protocol which we follow, and we advise the patient these all medicines. And with these medicines some percentage of hair can be rejuvenated where the hair loss is still going on. Means where some hair roots are still there, medical treatment can be helpful. But in areas where there is already hair loss is there is no hair roots left at all, the area is completely bald, in that area hair transplantation is done. So hair transplantation is a common process in which we take hair from the posterior part of head, which is called occipital region. The reason why we take from that area is because this area is destined to be permanent. You must have seen even the bald people, they have one strip of hair remaining there even at the age of 60, 65. These area hair, their DNA is like that they don't fall with the stress, aging, heredity, or they are not affected. So that means these roots are permanent. So that's why we take from that area and then we transplant them in front. So there are different methods of transplantation: strip method, FUE method, combination of strip of FUE. There are several debates on that, these methods, depending upon the patient's requirement and what is the desired number of follicles, thickness. So we decide which method to be done, and these transplanted hair, they never fall. You can do shampoo, you can do hair cutting, dye, you can completely shave the area, they will regrow again because we transplant hair roots. And the procedure, it takes around, depending upon the baldness, it takes around 4 to 5 or 6 hours depending upon the number of follicles which are being transplanted. This is a day care procedure. We put a bandage for around 1 day, 1 or 2 days depending upon how much the oozing was during the surgery. So 1 or 2 days the bandage is there. After that the bandage can be removed. There is a scab. A scab means crust type of thing is there, means current jisko bolte hain. Scab is there for around 5 to 7 days, maybe up till 10 days. So for 10 days it looks slightly odd. Means you have to, either you can put a scarf or cap or something on that area, but after 10 days you can resume your work. You can resume your work after 2 days also, but just to cover that scab you can put on cap. So this is very superficial procedure, so this doesn't hamper any of other your routine activity, and you can eat normally, you can do your normal work, and these hair, they are permanent. And we can take hair from scalp area, from beard area, chest area, so body hair can also be transplanted. In female also, the pattern loss or in female is usually around the partition line, so they want it to be filled along the partition line. So we do hair transplant in female along the partition line, or if anyone wants the whole head, so we do hair transplantation there also. And nowadays hair transplantation female patients are seeking hair transplantation even for eyebrow. eyebrow and eyelashes, somebody having scanty eyelashes, so we do hair transplant for eyelashes to give them long and attractive look. And eyebrow or eyelashes transplant is done in post burn patient also. So hair transplantation is common procedure. Because it's superficial, it doesn't have side effects. Very minor side effects like mild swelling or that scab which I have already told you, so that can be there, but there are no as such side effects. A very successful procedure.